Hello and welcome to Mike Stand, a podcast by the Student Alliance for Nationalism and Democracy of the University of San Carlos. I am your host, Patrick 𝗠𝗜𝗖, with my co-host, Chin Martin.
For this episode, we are honored to be accompanied by Dr. 𝗠𝗓𝗓 𝗦𝗧𝗔𝗡𝗗. She is an ophthalmologist at the University of Cebu Medical Center and is currently the training officer of the Department of Ophthalmology at Cebu Velas General Hospital. She studied in the University of the Philippines College of Medicine after being admitted to UP's highly selective intramed program as an ablation scholar. Wow. She received her master's in business administration from the University of the Philippines in Cebu, and she did her ophthalmology residency training, subspecialty training in cornea and external eye disease at the Philippine General Hospital and at Sydney Eye Hospital in Australia. She teaches at Cebu Institute of Medicine, UC School of Medicine, and Vicente Soto Memorial Medical Hospital. Yes, that's Dr. 𝗠𝗓𝗓, and she's here to enlighten us with her knowledge with our topic today that is controversial, timely, and relevant.
So our topic for today will be about the importance of the COVID-19 vaccine, its misconceptions, important information we the public should know about the vaccine. Please help me welcome Dr. 𝗠𝗓𝗓 𝗦𝗧𝗔𝗡𝗗.
Hi,
Hello, Dr. 𝗠𝗓𝗓.
nice to be here. Hoping dili siya controversial kayo gid na topic. But
Oh,
I guess
yes, Doc.
kinahanglan storya.
We would just like to ask you, how are you? How has your day been going with this pandemic and the busy hospitals?
I'm an eye doctor, so generally it's not my job to take care of the admitted patients. My friends are the ones doing a lot more work. I would like to reduce their work. So they're very, very busy because the hospitals in Cebu are really full sa karon. We're understaffed, no? We knew that naman na kulang tayo ng healthcare workers. That's why we don't want an overburdened healthcare system.
That's right. But Doc, the eye department, how do you call that, the ophthalmology department? Is that right?
Yes, at the ophthalmology department, yeah, most of our patients are generally well. They can walk, they're fine. If they have other diseases kasi na mas delikado, we try to get those diseases fixed first. Ang importante is that naay health screening. So, we don't accept patients in the hospital, in our clinic. If they are not feeling well, we will recommend teleconsult first.
Oh, okay. Thank you for that, Doc. We would like to start this off, Doc, by asking how do vaccines work and how important it is that everyone will get vaccinated. Because, there are a lot of misconceptions about this vaccine and there are a lot of people who are hesitant to get vaccinated. So, we would just like to ask you, how do these vaccines work?
Vaccines work to prevent disease, okay, or to reduce the severity of disease. That's how all vaccines work. And then the vaccine is different generally per disease. So, kitang tanan, we were actually all required to get vaccinated from birth. Like we were given the BCG vaccine for TB, as we were given para sa tetanus, para sa polio. So, when masugatan ta, we're given the anti-tetanus vaccine. So, all vaccines work to beef up our immune system. So, the way I explain that in Tagalog or in Bisaya is magbuhatag mga sundalo. So that simbako maigo ta with the real germ, okay, the real virus, the real bacteria, we don't get severe disease. We don't get it so bad. So the COVID vaccines that we have work that way. They work so that there is reduced severity of the disease, so that we won't need to be hospitalized. We don't get it so bad and we don't need to go to the hospital. We don't overburden the healthcare system. That's why it's very important that we all get vaccinated. Kasi karon overburdened na siya eh. Things are going to get worse from today. I predict that.
With everything going on, Doc, there are a lot of misconceptions going on, and I think most of those misconceptions are rooted from the fears people have from the vaccine or from the virus itself. And I think they mostly get it from news from their loved ones or from their friends. So for example, they hear that when you get vaccinated, you get symptoms mild or severe, for example, fevers, or sometimes even getting hospitalized after getting vaccinated. I think what we would like to clarify is, could anyone die from getting vaccinated?
No one has died from getting vaccinated. That's something that we need to emphasize. So the vaccines really are not dangerous. There are possible side effects. So the most common being pain at the injection site, swelling, fever, headache, muscle aches. Usually these side effects are relatively mild, 1 to 2 days lang, and then mag-ayod naman. And then we have medications like paracetamol for those common side effects. There are reports of some more severe side effects. Well, not really side effects, but adverse events that are reported after the vaccination. They're not proven yet to be because of the vaccination. So people might have heard of blood clots, Guillain-Barré disease, no? But we have to understand, Manggod, that these side effects are rare. May occur with actual COVID, with the actual disease. And if they do occur, no, if these adverse effects occur with the real disease, with COVID, they will be much worse than with the actual vaccination. So that's why ang karon is, even if na ay side effects, the benefit from the vaccines is greatly outweighs the risks associated with any vaccination.
Okay, I think it was very clear already, Doc, and that was clarified. And I have personally heard of that kind of rumor na makamatay daw ang vaccine. So at least the listeners will know karon na no one has died already from vaccine. But I also want to clarify, Doc, is that true to all vaccines? Like when you get vaccinated, not only from COVID vaccines, you will also have an adverse effect? Like you will also get fever or headache?
Yeah, those common side effects are common side effects to all vaccines. That's why yung kids, di ba, after they get the shots from the pediatrician, pwede silang hilanta nun. And then you give them paracetamol, no? Those are what we call reactogenic effects. They are proof that your immune system is working. Now, not everyone will get those reactogenic effects. Kay lahi-lahi man gyud ang bawat tao. But you get protected, no, when you get the vaccine. So you are better off than someone who is unvaccinated against whatever disease that is. I wish people nga, before they believe whatever it is they hear, they would pause to examine, does this make sense? Sino ba yung source ng balita na to? Does this source verify kung unsa iyang nadunggan before niya i-share? So actually, the reliable sources that I will recommend are the DOH, the Philippine Medical Society, the Philippine Medical Association. You can look up the WHO website, the CDC. Daghan kaayo. You can even ask your local doctor. So we are really trying to get the word out, get the correct word out, so that people will not believe the misinformation. It's just taking a lot of work. So again, I'd like to thank you for this opportunity to talk to you guys.
We are also honored, Doc, to have you here. We also want to eradicate this kind of misconception and rumor so that everyone will be encouraged to get vaccinated. But just another follow-up question, Doc. Is it okay for someone to get vaccinated while they have the COVID?
Okay. Sige. So, let's talk about who can get vaccinated. Okay, first. And then who cannot. So, generally, here in the Philippines, we followed a priority system because the vaccine supply is very limited. So in March, di una ang mga healthcare workers, so myself included. And then after that, yung senior citizens, they are in the A2 group, healthcare workers being the A1 group. Di una ang mga senior citizens after the healthcare workers because senior citizens are at higher risk of getting severe COVID compared to the general population. The A3 group, which comes next, are the people with illnesses, like asthma, heart disease, hypertension, diabetes. There's a long list actually sa DOH. But yun, generally is unahon yun after the healthcare workers ang mga tiguwang ug masakiton. And then after that, yung A4, yung economic frontliners natin. So if you work, if you go outside, you have to get vaccinated. And then A5 is in the indigent people, and then the general population will also need to be vaccinated eventually. We're just following the priority list because right now, vaccine supply is limited. Not just in the Philippines, but worldwide, with few countries as exceptions. Kinsay dili pwedeng bakunahan. Gamay ra kayong listahan. So, in the Philippines, we are not yet vaccinating people less than 18 years old because vaccine supply is limited nga. So, iuna ang mga adults, ang mga, senior citizens, those with comorbidities, working adults, kasi sila man yung mas higher risk na ma-hospital compared to kids. But later on, when vaccine supply is not as limited anymore, some kids will need to be vaccinated. Kinsa pay dili pwedeng bakunahan sa karon, aside from those less than 18 years old. So ang mga mabdos in the first trimester, in the first 3 months of pregnancy, dili sa pwedeng bakunahan. Ang pinaka-strict lang yun na dili yun pwedeng bakunahan are people who are allergic to the first dose of the vaccine or its components. So, that's something we want to emphasize. Para mahibaw-an kung allergic ka to the vaccine, you have to get the vaccine first. So, hindi mo siya uunahan ng takot. So, you should not think na, because you're allergic to seafood, allergic to eggs, chicken, things like that you might be allergic to the vaccine. You have to get the vaccine first. So, yun lang yung pinaka-strict na hindi pwedeng bakunahan. So, usbon ako, yung mga people with comorbidities, mga sakit, actually, kailangan talaga silang bakunahan, Kasi madaming tao na takot na pag may sakit sila, dili sila pwede bakunahan. They don't understand that they're actually in the priority list. Some special people with problems with their immune system na daan have to get medical clearance from their doctors prior to get vaccination. So those are people who underwent organ transplant. Those are people with autoimmune disease, with HIV, cancer patients undergoing chemotherapy, bedridden patients. So sila lang yung kailangan talaga ng medical clearance. Most everyone else is okay to be vaccinated. We just hope there is enough supply eventually.
there are a lot of different brands of vaccines, Doc. There's Pfizer, there's Moderna, there's actually Astra, Sino, and please excuse me if I have this wrong, but I think there's Sputnik, the Russian vaccine. I don't know if it's in the Philippines right now, but my question is, Doc, what are the different brands of the vaccine available and how effective are they?
So actually, the Philippines is kind of unique in that we have tried to get vaccines from as many sources as possible. So, yung pinaka-common nga na binibigay natin ngayon is the Sinovac and the AstraZeneca. Pfizer's been given. Moderna, very small amount pa lang yung nabibigay. There's the Sputnik. There's Johnson and Johnson. We'll also have the Covaxin from India. All of these vaccines work to reduce severity of COVID. No? Simba ko matakdan ka. So all of these vaccines work to reduce severity of COVID and reduce the severity that we will need, to reduce the likelihood that we will get severe disease and need to be hospitalized. They reduce the likelihood that we will die from COVID. Ang problem kasi is you really cannot compare the vaccines one-on-one. Okay? Kasi ideally, di ba, sa school we're taught man na when you conduct an experiment, you should have a control, you should make sure that the setup is the same. But the thing is, when these vaccines from different countries were made and distributed and used, they were not made in the same place, they were not used in the same place, they were not used at the same time. So different variants now were available in the different places at the time that these studies were conducted. But all the vaccines work to reduce severity and likelihood of hospitalization and death.
What you're saying, Doc, is that despite the difference of the efficacy rate of these vaccines, all of them do their work.
All of them do their work. The WHO initial requirement was 50% actually. No? Para makita talaga na nare-reduce ba yung likelihood of severe disease and death. So, we have great vaccines. We encourage people not to choose. Get the vaccine that is available earliest to you. So I feel very lucky that I was vaccinated within 1 week of the vaccines being available here in the country. So I happened to get the Sinovac vaccine kasi yun yung unang nadala sa Pilipinas. I have friends who received the AstraZeneca vaccine kasi most of my friends na are doctors, so we received either Sinovac or AstraZeneca. I know people who got other brands of the vaccines because yun yung naging available at the time na they got their schedule. So whatever it is that is offered to you first, take it. Huwag maging mapili kasi hindi naman talaga kailangan maging mapili. All the vaccines work.
Yes, Doc, you just answered my follow-up question also, because I was gonna ask you about this issue because, well, some of my friends also and some of my relatives did not sign up yet because they were waiting for a specific brand of vaccine, and I told them that whatever vaccines are there, you should grab it because that's an opportunity. Because that's, it's free from the government as of now. So you need the opportunity to grab it and do not just choose between the brands because they're all effective. That's what I told them. But maybe they didn't really listen to me because I was not a medical expert. But that's why I'm so excited to let them hear this podcast now because they will hear it from you, a medical expert.
Ang problem kasi is we don't know kung kailan tayo matatamaan. That's the problem with infectious disease.
That's very true.
Disease, no? So, kailangan natin siyang unahan no? We have to survive this. We just have to survive now.
That's true. I would just like to ask, in your observation, who are these people availing the vaccines? Like, do most of them belong to the lower class? Because in my own experience, when I was vaccinated, I have seen my friends there and some of the mothers of my friends, the relatives of my friends, and I did not really see people from the lower class. The people who were lining up are coming from the middle class. So I just want to ask you, in your own observation, do you think many of them come from this lower class? Because most of them are prone to the rumors that we have just talked about, like the vaccines could kill us or vaccines could make us worse. They are prone to misinformation and misconception.
Ganito, I've volunteered here in Cebu. We have the LGU and the PBB sites, no? The Project Balik Buhay sites. So I think I volunteered in 4 PBB sites and 5 LGU sites. Unfortunately, I do not see a lot of people from the lower income group getting vaccinated. The first people who I got to see vaccinated were actually yung may kaya. Okay? These are people who actually simba ko ma-hospital. Sila yung may resources para para mugasto para sa hospital compared to the lower income classes na alam ko vulnerable, no? So I trained in UPPGH, so I really feel for the vulnerable population kasi yun nga ang turo sa amin was mahirap maging pulubi at may sakit. So we were taught to always remember that. The thing is, yun nga, there's a lot of misconception going around, lot of misinformation. So, yun nga, we are working together. Like right now, we are working together to try to reduce that misinformation. Unta, masabtan sa tanan that kining bakuna para mani sa atong tanan. Hindi siya gyud delikado, no? Is para unta dili manginahanglan ma-ospital, dili mamatyan og kauban sa pamilya, dili mamatyan og loved one. I really wish na masabtan na sa tanan.
Yes, I was also about to say, because as what I have said earlier, I have noticed that the people who were in line with me are the people who, as what you have described, may mga kaya, no? May kaya kung simba ko lang og ma-hospital. And when we talked here at home, our house help, they didn't want to get vaccinated, and the rumors that they have heard also came from their barangay lang also.
I think yun nga, there's a lot of mistrust man god. People will trust na lang the people they know, the people who are close to them, but unfortunately, those people are not always the most learned. We have to try to make ourselves understandable. No? Wala may pugsanay, pero unta kung makasabot lang tanan yun ug maayo about this pandemic and how we need to get vaccinated to get out of it. Unta yun.
Doc, if anyone gets vaccinated, is it possible for them to still acquire the virus?
It is still possible. So that's the reason why here, no, even for the vaccinated people, we still recommend that you still continue following the minimum public health standards. So please wear the mask, face shield, avoid crowded places, avoid closed spaces, be in areas of good ventilation, and follow strict hand hygiene. That's advice to everyone, whether you are vaccinated or unvaccinated. The thing is, you still can get COVID, but it's not as bad COVID anymore. So less yung likelihood na you will have severe disease and you will need to go to the hospital. Ang kan lang is because you can still get COVID, it can still stay in your airways, no? In the nasal passages and the nasopharynx. When you take off your mask, you can transmit it to others. And you don't know kung sino yung unvaccinated in your area. So, ayaw nating nakakahawa pa rin yung mga tao. So, please wear the mask. Again, whether or not you're vaccinated, please wear the mask yun. Properly, ha? The mask has to cover the nose and the mouth. When hindi nakaka-cover both the nose and the mouth properly, that mask is not working.
Just to clarify, Doc, about people who are already vaccinated. So, the vaccine isn't a cure. It's, kumbaga,
Yes.
it's just another added layer of protection for
Yes.
all of us.
You,
As you said
you use,
earlier.
you use the correct word. We need kasi layered protection. So the mask, face shield, that's one layer. The improved ventilation, another layer. The hand hygiene, that's another layer. Avoiding other people, no, yung physical distancing, that's another layer. And the fifth layer is the vaccine. So that unta again, we don't get severe disease. But it is still possible to get the virus. Now, the thing that happens kasi if you're unvaccinated, yun nga, mas magma-multiply yung virus in your body. That's why you will get severe disease. Whereas if you are vaccinated already, no, na boost na nga yung immune system mo daan, na nakay sundalo pang fight off sa virus, that's why you will not get a severe disease.
Yes, because a lot of people also, Doc, no, I have seen most of the people who are going out already as if there was no pandemic already, because what they say is that I am fully vaccinated already. That's their reason and that's their alibi, no, to go out and have fun
Actually,
outside.
same. I have friends that are already going out because they got vaccinated na.
So, yun nga, yun yung delikado. We cannot be complacent yet. Our community is still under-vaccinated. Okay? We cannot be complacent yet. So, just as an example, let's look at the US. Okay? They haven't reached 50% of the country fully vaccinated yet. And then they relaxed. And now, they're asking people to mask up again. Tayo kasi, because we understand that dili pa tayo fully vaccinated daghan, no? We never relaxed our mandate for minimum public health standards. But it's difficult to enforce, no? Kasi yun nga, each person has to take responsibility for their actions, not just for themselves, but also for their loved ones and the other members of the community.
That's very true.
It's good to think about yourself, have fun, take care of your mental health and all that, but always think of others also. So that's why actually the Pope, yun nga, he advocates nga the vaccination kasi yun nga, you're thinking not only about yourself, but you're thinking about other people as well. So, di ba, I'm not sure if you guys are Catholic, but yun nga yung iampo natin di ba? Every Sunday, we pray the Orasio Imperata. We thank you, Lord, for the vaccines. Now they're here, we have to get them into the people. And even if we get them into the people, we still have to follow the minimum public health standards.
That's right. And I hope our listeners are listening to what you have said, Doc, to not be complacent even though we are vaccinated. And by the way, Doc, you have mentioned a while ago about the categories like the A1, A2, A3. Like how many categories are there?
There are actually yung A1 to A6. Okay. I think A5, sige, ulitin ko lang, A1 healthcare workers, and then may mga binagong categories about A1 kasi parang OFWs who are supposed to leave in the next 4 months, naging A1 na din sila. A2, elderly. A3, those with comorbidities or may mga sakit. A4, the economic frontliners. Basta if you work, you're there. A5, indigent. A6, I think is other workers ba? Hindi ko din memorize to be honest eh. Tapos merong B. Tapos C is the rest of the population.
Where are we in the categories, Doc?
So right now, Cebu is serving up to A5. But because of scarcity of supply, priority gihapon yung A1 to A3 because of scarcity of supply. So the A2s are being prioritized in the different LGU centers. I think the A2s are being prioritized now because the A1s are expected to have been vaccinated already.
Just a question lang about what you have said a while ago, Doc. The people who belong to the lower class are not belonging to the A2 category or the A3 category or the A1 category. So they automatically are in category C.
Lower class indigent people are, I think, in A5, but they have to be listed lang sa barangay. The barangay will help to facilitate their vaccination.
Oh, I see, Doc.
But if you're working outside, kung may trabaho ka, you are A4.
Regarding the vaccines, we have heard also another term, no? When we talk about vaccination or when vaccine informations are being posted online, there is this term called herd immunity. What is this herd immunity?
Herd immunity refers to people getting immunized, no? Protected against a disease, either by natural means or by vaccination. Tapos, you need to reach a certain threshold. So, in the Philippines, we are aiming for 70%. That's what we're aiming for, that if we can get the 70% of the population vaccinated, then we can have the disease controlled in our community. So right now, we are at less than 15% fully vaccinated here in Cebu. We are less than 10% fully vaccinated in the Philippines. So, we have to remember kasi, di ba, may gimension ko kanina na not everyone can be vaccinated yet at this time. So, appeal yung kids, less than 18 years old cannot be vaccinated yet. Those bedridden, no, nalisod makaadto sa vaccination center. Those na may mga sakit nga na hindi sila mabigyan ng medical clearance for vaccination. Sila yung may iwan sa 30% na hindi talaga pwedeng bakunahan pa sa ngayon eh. But if we can get everyone else vaccinated, 70%, then at least dili ma-overwhelm ang atong healthcare system, dili ma-burden kaayo. The thing is, immunity, I mentioned, no, you can get it naturally or you can get it via vaccination. Pero yung natural immunity, medyo buwis buhay yan. you are gambling. You don't know if you're going to get better or you're going to get so sick and die. Whereas for vaccination naman, if you go through the vaccination route, you will not die from the vaccine. So that's the safer way to go. The last time the world had a pandemic, it was around 1918, 1919. Yun yung Spanish flu. I'm not sure if you guys have heard of it kasi definitely none of us were born pa at that time. 50 million yung namatay. Kasi wala pang bakuna at the time eh. Hindi pa uso yung bakuna. Now, we have vaccines to keep the deaths low. And we have 4 million people dead worldwide already due to COVID. Ayaw nating umabot ng 5 million or 6 million. Diba? So, yun nga. Again, we want to encourage people to get to herd immunity the safer way.
With our current state, Doc, you mentioned earlier that the percentage of our country that is already vaccinated was under 10%, under 15%.
Yeah.
Cebu
Fully
is under,
vaccinated.
Cebu itself is under 10%, if I'm not mistaken. So, with our current state right now, with how vaccinations are rolling out, when do you think are we likely to achieve herd immunity?
If everyone gets vaccinated, when the vaccines become available, we will probably get there next year. But everyone has to get vaccinated when the vaccines become offered to them. Yun. Walay balibaray, walay pili-pili. Na siya. It's not going to happen this year kasi yun nga eh, medyo vaccine supply is limited worldwide.
And with all the hesitancies, said Doc, it's very difficult for everyone to get vaccinated.
I personally find it hard to encourage people. If you were going to speak to them, how would you encourage the people to get vaccinated, even if they're still hesitant or they don't want to get vaccinated?
Paulit-ulit ko lang ini-explain talaga na lahat naman tayo na bakunahan eh. Kasi nga, we were required to get vaccinated when we were kids. Mandate yan sa Philippines that all of us get vaccinated for tuberculosis, for polio, for tetanus, and the measles, mumps, rubella. Lahat tayo nung bata tayo, nabakunahan tayo. Ngayon lang kasi is we're adults, hadlok-hadlok na sa karayom, di ba? We have to give consent before ta bakunahan. So, storyahan lang yun. There are people na kailan na mo na hesitant sila ni adto, and then kung storyahan og tarong makasabot man or they change their minds tungod kay naanay kaila na nabakunahan or nahadlok dili na pasudlon sa mall kaya nagpabakuna. I heard that reason just recently. I guess we just have to talk again. If you individually, you don't feel confident talking to your loved ones about vaccination, it's not difficult actually to ask for help from healthcare workers. So I am not alone in advocating vaccines. The Cebu Medical Society, the Philippine College of Physicians, the different specialty societies of doctors, encourage vaccination talaga kasi alam namin naintindihan namin yung science behind the vaccines. So if you don't feel confident as an individual, as a young individual, talking to people, uh, ask for help. We really can, no? We really can do this kind of thing for as long as you need us to.
Yes, Doc. I'm really trying to talk to them and get in touch with them. And I even mentioned some artista names so that they will just to encourage them in all ways. So I'm really looking for more information, and this podcast really helped so that I can better inform them and better explain to them how vaccines work.
Yeah.
Thank you for that, Doc.
If you want them to listen to this podcast, and then yun nga, para unfiltered nilang maget, ma-feel nila na ikaw ikaw na nagmamalasakit, that you love them, kaya mo sila gustong mabakunahan. Encourage natin yun, no? I've heard kasi too many heartbreaking stories about loved ones being lost, okay, because of this pandemic. And every death is preventable now with the vaccines. So, yun yung pakiusap namin kasi sa relatives namin, we would feel really, really bad if we lost them now that we have some protection, due to the some protection that vaccines can give us. So if we just need to talk and talk again, then we'll try. Baka pag nakita din nila na madami naman palang nagpapabakuna. When they go to the vaccination center, they will realize they are not alone. And
yes,
in the
that's very true,
vaccination center, we really talk to them again. No?
And by the way, Doc, you mentioned earlier that about volunteering to get vaccinated. And as far as I know, getting vaccinated is not compulsory, but rather you have the freedom to do so or choose to not be vaccinated. Am I correct?
At this time, yes, you are correct. At this time, we cannot mandate vaccinations for everyone yet because supply is limited. Ang hirap kasi pag mag-require ka pero hindi mo naman mabigay, di ba, yung bakuna kasi kulang pala. That's why we cannot yet mandate vaccinations for everyone. But that might change in the future.
I see, Doc. Pero if ever that will change in the future, and I see also news already from some places in the world that people who are not vaccinated yet cannot go inside the malls, cannot go inside establishments. It's taking away freedom,
spaces.
I see. It's just for the protection of everyone.
For the protection of everyone, yes. So, enclosed spaces, manggod. So, I really do understand the hesitancy. I haven't eaten in Jollibee, the establishment, for a while. That's the example that I give. And I love to eat, I really love to eat. I haven't eaten indoors in a restaurant since the pandemic started. Always take out, outside lang. Syempre, nung wala pang bakuna, of course, manggid ka to go grocery, no, to do your errands. Careful lang yun, diba? You never go to a place outside your home without your mask on. That's the thing. But yun nga, later on kasi rules may change as more information becomes available.
Yeah, that's very true, Doc. But there is also this issue that people do not only not rely on the information about vaccines and not trust vaccines, but also they do not believe in the virus itself, the COVID itself. So while So for this last question, Doc, while we recognize that it's hard to convince people to get vaccinated, people are starting not to believe that COVID-19 exists in the first place because they haven't experienced it, nor do they know anyone who has it. And what message do you have for these people who do not believe in vaccinations and in the virus as well?
The science is there, there really is information, di ba? Whether or not you choose to believe it, that's an individual choice. But for the people who refuse to see the truth, eventually, they will have to accept the truth because the truth will hit them really hard. And that's not something I wish on anyone, but that's what's going to happen. I have been, like, for example, with certain friends, no, non-medical classmates. Ang kulit ko, pabakuna kayo ha, get your loved ones vaccinated, please. So, and then yesterday, I got a call from one of my classmates na yun nga, yung mom niya unvaccinated, elderly, bumababa yung oxygen. So, I feel really, really bad. Oh, I really hope that doesn't happen to the deniers or the anti-vaxxers. But maybe it will take that to get people to believe.
I agree with you, Doc, because with this news, with the information and the news that we have been receiving, not only in the Philippines but also around the world, I mean, it's enough evidence that this pandemic is true, that this virus is true, and sana no, I agree with what you said, Doc. Sana it will not get to the point that they will believe in this happening or in this pandemic because some of their loved one is already affected, or some of the people that they know are already affected. Thank you so much, Doc, for being with us today. Thank you so much. We have learned a lot from you, especially me. No, I really am listening to you, and when I was listening, I kept nodding. I have learned a lot of new information that I am ready to share to others also. So thank you for that, Doc.
Thank you also, Doc. I was really thankful that I could learn a lot from our interview with you. And I'm really excited for everyone to listen to this podcast, Doc.
Let's pray. The medical community, unfortunately, kind of expects things to get worse from today because we understand na that we are under-vaccinated at this time. So we hope for everyone to be careful, no? Stay at home kung hindi naman kailangan lumabas. And then, yun nga, dasal lang tayo.
Yes, Doc. So for our listeners today, before we end this podcast, we would just like to give you some takeaways of what we have discussed a while ago. Vaccines work to prevent or reduce the severity of diseases. We all know that there are vaccines for different diseases, and one of them is the COVID-19. And so we have this vaccine today. We should grab the opportunity to take it. Let me clarify to the listeners, vaccines do not cause death. And yes, maybe after getting vaccinated, you will be experiencing mild symptoms like getting nauseous or having fever, or your left arm or right arm will be sore due to the injection. But these side effects are just proof that the vaccine is working or that your immune system is working. So beware also, guys, with fake news, because fake news is everywhere nowadays, especially with regards to the COVID-19 and the vaccines also itself. If you want to know more about who can get vaccinated, you can go to your nearest barangay and ask if which category you belong, and sign up as soon as possible if you belong to A1, 2, 3, 4, 5, and etc. As we mentioned, that the people who can get vaccinated are people who are 18 years above, people who are 18 years below, and people who are, I mean, women who are pregnant in their first trimester, and people who are allergic to the first dose of vaccine or the components are not allowed to take the vaccines yet.
So as mentioned in our interview earlier, the Philippines has a lot of sources, so there isn't really a comparison to the vaccines. So as what Doc Myra mentioned earlier, whatever is available now is the best choice. Again, the vaccine is for all of us, so we don't need to be hospitalized. It's used to beef up our immune system. People should listen more to reliable sources instead of what they hear from rumors and what they see on social media. So not everything said by someone is relevant. As mentioned earlier, there are factual and relevant sources like the DOH, the WHO, the Philippine Medical Association, and many more, and even local doctors that could help us with our questions about the vaccine and about COVID itself. People who are vaccinated should still be cautious and, as mentioned earlier, should still practice the minimum requirement of social distancing, wearing a mask, wearing a face shield, because even though you're already vaccinated, you could still get infected with the virus, or you could still pass it on to someone else. You could be a carrier. And if you're not vaccinated, the virus will multiply inside your body. That's why you'll experience severe symptoms. However, if you're vaccinated, you have soldiers that will fight the virus. Although it's not a cure, it's an added layer of protection that will help your body fight the virus. Lastly, everyone has to get vaccinated so we can achieve herd immunity. As what Doc Myra mentioned earlier, the Philippines is aiming for 70% of the population, and right now we're not remotely close, but we're getting there. So everyone has to get vaccinated. I think that's it. So thank you, Doc Myra, for joining us today as we talk about the importance of the COVID-19 vaccine. We are so honored to have you for our first ever episode of this year, and I hope the listeners have learned and have fun as well as us, and have gained a lot of insights from our interview with you. So as a student organization, STAND could help contribute to the dissemination of information of the importance of getting vaccinated, like, for example, this podcast, or in other ways.
That's right. Also, STAND always upholds the attitude of knowing the facts, especially in this matter, and using these facts to spread awareness to people, especially those who do not have the reach to these informations. So guys, if you are listening right now, please help us in disseminating the right information, the facts about this pandemic, about the virus, and of course, the vaccine. Also, help us encourage people now that you have heard what Doc Myra has shared to us. So please also help us in encouraging people to get vaccinated. Thank you to the Carolinians for listening to our episode today. To access more of our podcast episodes, make sure to follow us on Spotify at Mike Stand, and like our Facebook page at Student Alliance for Nationalism and Democracy - University of San Carlos.
That's right. Stay tuned next month where we talk about the importance of voting. So if you're a first-time voter, or if you haven't registered yet, tune in to find out more about the deadlines, about the registration and procedures, and our roles as voters in upcoming election. Our guest speaker will be Sir 𝗔𝗠𝗖 𝗦𝗧𝗏. You may also send us your questions on our Facebook page, again, Student Alliance for Nationalism and Democracy - University of San Carlos. This has been Patrick Tarongoy and Chin Martin with Dr. Myra Ocobillo.
And we always should remember that the greatest victories can be achieved with the mobilization of the Filipino masses and its students. Thank you so much and good day.